Let us talk about the common flu symptoms. Usually, the flu symptoms are more severe compared to the cold symptoms and they come on quickly. Symptoms of flu include sore throat, headache, fever, muscle ache, soreness, congestion, and cough. Swine flu in particular is also associated with vomiting and diarrhea. Most flu symptoms gradually improve over 2 to 5 days, but it is not uncommon to run down over a week's time. A common complication in flu is pneumonia, particularly in younger, elder, or people with lung and heart problems. If you notice shortness of breath, please let your doctor know about it and take immediate treatment. Another common sign of pneumonia is fever that comes back having been gone for a day or two. Just like the cold viruses, flu viruses enter your body through the mucous membranes of eyes, nose, or mouth. Every time you touch your hand to one of these areas, you could be infecting yourself with a virus. Hence, it makes very important to keep your hands germ-free by frequently washing your hands or using sanitizer to prevent flu or cold symptoms. How do you know whether you have a flu symptom or a cold symptom? Many experts say you should always check your temperature to check if you have a cold symptom or a flu symptom. Flu symptoms often mimic cold symptom, usually with nasal congestion, cold, cough, aches, and malaise. But a common cold rarely has a symptom of fever which is 101 degree and above. With flu symptoms, you'll probably have a fever along with the flu virus and later on you will feel miserable. Body and muscle aches are also very common with the flu. When do you call a doctor? When you have a flu or a cold symptom, and also when you have the following severe symptoms, you should call your doctor. Persistent fever. A fever lasting more than 2 or 3 days can be another bacterial infection and it should be treated immediately. Painful swallowing. Although a sore throat from a cold or a flu virus can cause a mild discomfort, severe pain in your throat may also mean it is a strep throat, which means you immediately need treatment by a doctor. Persistent coughing. When a cough doesn't go away in 2 or 3 weeks, it could be bronchitis, which needs an antibiotic medication. Postnasal drip or sinusitis can also result in persistent coughing. In addition, asthma is also another cause of persistent coughing. Congestion and headaches. When cold and allergies cause congestion and blockage of sinus passages, it leads to sinus infection called as sinusitis. If you have the pain around your eyes or the face with thick nasal discharge, then you might have developed a bacterial infection which may need antibiotic. However, most sinus infection does not need an antibiotic for its cure. In some cases, you may need to get immediate emergency medical attention right away. In adults, the sign of crisis may include shortness of breath, severe chest pain, severe headache, dizziness, confusion, and persistent vomiting. In children, additional emergencies are difficulty in breathing or rapid breathing, bluish skin color, and not taking sufficient fluids. We may also find lethargy and extreme irritability and distress. Symptoms that were improving once and suddenly get into worse situation along with fever and rash is another emergency situation among the children. Can we prevent flu or cold symptoms? The most important prevention measure to avoid cold and flu symptoms are to wash your hands frequently. When you wash your hands with warm soapy water at least for 20 seconds, it helps you remove the germs from your skin. In addition to hand washing, to prevent flu or cold symptoms, you may also get flu vaccines done at the nearest hospital to prevent seasonal influenza. Within 2 weeks of getting flu vaccine, the antibodies develop in your body to provide protection against flu virus. Children receiving the flu vaccine for the first time need 2 doses at least delivered 1 month apart. So dear friends, I trust the given informations about the common cold, the flu, and the differences between the common cold and the flu, their symptoms and the causes, and how to prevent them have been useful to you. If you like our video, like, comment, share and subscribe, and keep watching us for the next episodes in the coming days. Thank you and bye bye.